Female athletes are 2 to 8 times more likely to tear their ACL compared to their male counterpart. But why? What is it about the female body, the anatomy, the biomechanics, or even hormonal changes that makes it so much more common in female athletes? Today we're breaking down the 4 biggest reasons why female athletes are at a higher risk of ACL tear and what we can do to reduce that likelihood. So first, let's talk about anatomical differences. Plain and simple, the female body is built differently than the male body. And this can absolutely affect movement patterns, which can secondarily affect the way in which the strain on the ACL occurs. The first anatomical difference that we see is generally females have a wider pelvis than males. Anatomically, this is due to childbearing reasons, but nonetheless, a wider pelvis increases what's called the Q angle or the quadriceps angle. The Q angle is the angle between the ASIS of the hip and the patella. This wider Q angle in the female athlete will absolutely affect the tracking of the knee when a female athlete goes to jump, land, or cut. The term that we use to describe the movement of that line between the ASIS and the patella when an athlete is moving is called a dynamic Q angle. An increase in dynamic Q angle has the capacity to cause an inward movement of the knee when an athlete or female athlete jumps, lands, or cuts. This is called the valgus position of the knee, or dynamic valgus position of the knee when the athlete moves. This has the potential to cause increased stress on the joint, particularly the ACL in certain circumstances. Secondly, we have the intercondylar notch. This is the notch or tunnel in which the ACL sits inside the joint. Studies have shown that the intercondylar notch in the female athlete tends to be a little bit more narrow. And the more narrow the tunnel is, the less movement there is for the ACL to occur during these high-level movements, which may predispose the female athlete to more impingement and tearing on the ACL. And lastly, the third thing that we talk about anatomically is ligamentous laxity. Ligamentous laxity just refers to what we consider to be like the looseness or flexibility of the ligament. This increase in laxity reduces the knee's ability to absorb and distribute forces efficiently, therefore increasing the susceptibility to injury to the ACL. Anatomy is just one part of the equation. The next major risk factor that I want to talk about is what we call biomechanics, or the way in which the body moves. Studies have shown that when females land, there tends to be less knee flexion and an increase in knee valgus, as we discussed earlier, compared to males. This change in biomechanics when a female athlete decelerates or lands actually changes the force or the absorption of the musculature within the joint or surrounding the knee, which then predisposes that female athlete to strain certain areas of the knee compared to males. Another key biomechanical difference that we see is hip and core control. So what does that look like biomechanically when we talk about lack of core strength and lack of hip strength? So in this video, obviously you can see 2 things going on. First and foremost, that knee falls in. This can be due to a lack of lateral hip strength, the lateral hip rotators, but you also see a trunk lean, and this is where we consider to be that frontal plane stability or lack of core control. So when an athlete cuts left to right in these lateral movements, that's what we call frontal plane stability. So in order for that to happen, because these movements happen at such high levels and they happen across all sports, you have to be able to have control of not only the core, but also the hips. So thirdly, we have hormonal differences. In certain phases of the menstrual cycle, particularly when estrogen is at its peak, ligaments are actually more susceptible to stretching and tearing. This is due to hormonal fluctuations, which can alter not only neuromuscular control, but also proprioception, making the knee less stable during high-level movements. Lastly, one of the biggest and most modifiable risk factors is neuromuscular control. Neuromuscular control refers to the ability of the nervous system to coordinate muscle movements in response to demands of the body. I want to talk about 3 major factors when it comes to neuromuscular control, the first one being proprioception. Proprioception is the body's ability to assess joint position and movement, which is crucial for stability as we move. Proprioception is a key indicator for potential injury, and regardless of female athlete or male athlete, tends to be a major target in these rehabilitation programs or injury prevention programs that we design to decrease the likelihood of ACLs. The second neuromuscular control factor that I want to talk about is quad dominance and hamstring activation. So as we discussed earlier, the female body tends to, or at least athletes that are more predisposed to ACLs, that female body tends to have less knee flexion during deceleration or landing mechanics. This is what we call a quad dominant athlete. So think about this visually with me for a second. So someone who is more quad dominant, think about what the quad does. So the quadriceps muscle turns into the quad tendon, runs over the patella, turns into the patellar tendon, and then eventually transitions to attaching to the tibia or the shin bone. So if someone who is quad dominant or uses more of their quad to load during these deceleration and landing events, think about what that does to the shin. So if you have a quad that is overpowering what the hamstring can do to distribute those forces, you're essentially pulling on the tibia more than you would otherwise. And as we talked about in other videos, that term is described as anterior tibial translation. So you're pulling the tibia forward, which therefore increases the stress that's placed on the ACL, because the ACL's job is to resist anterior tibial translation. So how do we change this neuromuscular adaptation? So think about it this way. Someone who is more quad dominant, when they land or decelerate, they're using more of their quad as opposed to their hamstring to dissipate those forces. You want an appropriate ratio between the two, because the hamstring's job is to essentially reduce the likelihood of an anterior tibial translation. So it almost counteracts the quad's ability to pull that forward and increase the likelihood of an ACL tearing. So the appropriate ratio between the two is important. As we talked about earlier in the video, males actually have a little bit more control of the hamstring, so when they land, there's more knee flexion but also hip flexion as well. Compared to females generally, or those who are predisposed to ACLs, female athletes land with less knee flexion. So they're not using as much of their hamstrings to load their hip and to decrease those likelihood of that anterior tibial translation happening. So now that we've discussed these 4 factors, anatomical, biomechanical, hormonal, and neuromuscular changes, or risk factors that can predispose that female athlete from injuring, where do we go from here? So the good news is that we can control this, or at least we can change or reduce the likelihood of ACL injuries occurring. Whether it is in the gym, as we talked about earlier with someone who's more quad dominant, we can affect their hamstring to quad ratios. But more importantly, as we discussed last, is the neuromuscular control. The neuromuscular control has the biggest modifiable change that we see, particularly with some of these programs that we've developed for female athletes during warm-up sessions and during training that we can affect and significantly reduce the likelihood of tear rates. Programs such as the PEP program or the sports metrics do a great job of incorporating neuromuscular changes throughout training programs. But the one piece of evidence that we've seen to reduce those ACL tear rates the most is what's called the FIFA 11 Plus. The FIFA 11 Plus program over any other program has shown the biggest reduction in ACL tear rates. Over thousands of athletes and thousands of hours of exposure time, studies have shown that the FIFA 11 Plus can actually reduce the likelihood of tear rates up to 30 to 60%. It's kind of somewhere in between, most are around that like 45% range. This is significant. So when you look at athletes and you look at their potential increase of injury risk, especially the female athlete population, implementing the FIFA 11 Plus and these other programs is crucial and needs to be implemented more in order to reduce these tear rates. So what is the FIFA 11 Plus and what does it look like? So on the screen there is what you see as the FIFA 11 Plus. It essentially is a structured warm-up. So it was designed for soccer players because soccer players, at least female soccer players, have a tendency to tear more than any other sport. It was designed for a structured warm-up in which neuromuscular control, biomechanics, some strength involvement was implemented prior to a training session over several weeks. And what studies show, as we mentioned, is a significant reduction in tear rates. So aside from the neuromuscular training that we see with the FIFA 11 Plus, the PEP, sports metrics, obviously there are other things that we can change, as we mentioned. Strength training, endurance training, along with neuromuscular control can all have a huge impact on how the body moves. So we need to be able to look at different ways that we're training these athletes and ways to implement them simple yet effective. We're never going to be able to get the injury rate down to 0 amongst males, females across all sports. It's not going to happen. But the fact that the female athlete population is 2 to 8 times higher likelihood of tearing, we have to find ways to implement these injury prevention strategies, disseminate this information such as this video out there. So like, subscribe, share this knowledge. We want to be able to provide this information to the most people possible to reduce these tear rates. Thanks for watching. If you're a physical therapist or other medical professional looking to elevate your ACL rehab practice, visit tornuniversity.com and book a one-on-one consultation where you can speak with me directly about any specific challenges you may face and fine-tune your approach to ACLs. Also be sure to check out my monthly webinar series where I dive deeper into ACL related topics designed and shaped by your specific needs and questions. Don't forget to like, subscribe, hit that notification button for more content, interviews, and more. Follow me on social media at Torn University for more daily ACL related topics. And as always, drop any comments or questions you may have about ACLs, and I'll catch you guys in the next video.